Your local Right at Home office is always concerned about the safety of its employees and clients. Here are some important safety tips your employer may follow regarding infection control, fall risks, lifting, moving clients, transportation, and errands. Wear gloves when you might have to touch blood, bodily fluids, or items contaminated by bodily fluids. Wear a mask and possibly a gown when you think you might be splashed with the client's blood or bodily fluids. Always wash your hands with soap and warm water for at least 20 seconds after you come in contact with blood, bodily fluids, or contaminated items, including trash, even if you were wearing gloves. Washing your hands is the single most important thing you can do to protect yourself from germs at work and at home. Ask your supervisor about your employer's policy in the event you or your client develop an illness, or if your client's behavior has changed in any way. There are many things that cause a greater chance of clients falling, such as decreased muscle strength, reflexes and vision, and side effects from medications and arthritis. In fact, falls are the leading cause of injury in people over 65. Fortunately, there are things you can do to lower the chance of a fall for you and your clients. Watch out for liquids spilled on the floor. They can create a slippery surface. Watch out for loose electrical cords, rugs, frayed, torn, or uneven carpeting, and other items on the floor that may be dangerous to your client and you. If you cannot remove the objects, tell your supervisor about them. Pay attention to uneven stairs or stairs that do not have a handrail. Do not allow any items to be a fall risk, such as items left on stairs. Make sure your client is wearing shoes that fit properly and have good traction. Be cautious in areas that have poor lighting. Check for non-skid surfaces in the bath area. Many potential hazards can be fixed. Notify your supervisor if you see potential fall dangers. If a client should fall while you are in the home, call 911 if appropriate. Discuss with your supervisor about what steps you should take to document the fall and your observations. It is very important to ask your supervisor about your local office's policy to prevent falls and follow it exactly. In the course of your day, you may need to do various levels of lifting. A best practice is not lifting anything you believe is too heavy. When lifting, remember to lift with your legs, not your back. When you need to bend to retrieve something, bend at the knees, not the waist. One last note about safety. There may be instances where you are asked to run errands or provide transportation for a client. A best practice is that you should check with your supervisor each time before performing these tasks. There may be reasons or safety concerns that mean the client should not be left alone or should not be transported in an automobile. The client might not tell you about those reasons, so always follow your local office's direction and plan of care for the client. Your local Right at Home office may allow that a plan of care can be modified by the appropriate Right at Home representative, as long as you speak to your supervisor first. By taking precautions and following standard care procedures set out by your employer, there is a better chance that you and your client will remain safe and secure during your time together. In any situation where your client or you are injured or not feeling well, contact the local Right at Home office you are employed by immediately. If it is a serious injury requiring immediate emergency assistance, call 911 first, then call the local Right at Home office that employs you. Ask your employer about your local office's policies regarding injuries and illness. The local Right at Home office you work for likely has a policy that any injuries or serious illnesses to you or the client must be reported to the office as soon as possible. If you are not sure if you should call for help, a best practice is to err on the side of safety and make the call.